evening and welcome to tonight's Oakland Community Health Network Board of Directors meeting. At this time, if you can, please rise and join us in the Pledge of Allegiance. Pledge allegiance to the flag, republic for which it stands, visible with liberty and justice. Feel of the roll call, please. Is it?
Here. Here. Here.
Present. Thank you. At this time, it is the first of two opportunities for public comment. All of our board meetings are subject to the Michigan Open Meetings Act, and public in attendance are permitted to speak, as well as we do also allow online comments. It is our policy to allot 3 minutes to each speaker. And at this time, if you generally we take those online first. Do we have anyone? There are? No?
Would anyone wish to speak public comment?
Is there anyone online?
No.
Okay, there being no one, well then, we did have a sign-in sheet. You don't have to sign in if you do want to speak. After there is one person I will call upon because they did sign in. After that, we'll do it by just calling you up if you wish to speak after being recognized. Jody Gorenflow. I apologize if I didn't say the last name right. I got it. Okay, I'm good. Okay, I'm improving. Jody, welcome.
Thank you very much. Excuse me, I'm a little nervous tonight. My name is Jody, and I've worked for OCHN for almost 6 years. I'm here tonight to appeal to you on behalf of myself and all of my fellow OCHN staff members. The benefit changes proposed at last week's COW meeting felt like an absolute gut punch. I heard it stated that 100% of the benefit increase will be passed on to staff. This upcoming year, before any events, the premium for our new PPO plan is increasing by $2,392. OCHN has pledged to provide a total of $2,750 co-insurance benefits for a family, which is a total of $9,950 less than last year. This means that if my family, like so many other families here at OCHN, experience one or more unexpected medical events or need ongoing care for chronic conditions, we will potentially be out no less than $12,342 next year. Not only will this be coming directly out of my paycheck, but it offsets and is even more than any financial performance compensation I've received for the past 5 years combined. It is frightening. Last year, 2 of my dependents both suffered several medical events and needed care through no fault of their own. And since my husband's open enrollment ended 2 weeks ago, I personally am out of luck. I remind you that our loyalty to OCHN, our fellow staff, our leaders, and the people we serve has been unwavering. We persevered through COVID, through our own fear and uncertainty and anxiety, and continue to serve individuals in Oakland County despite the hardships we were experiencing ourselves. We are very humble public servants, not dissimilar to yourselves. We don't do what we do for glamour or flash or status. and we certainly didn't go into this line of work for wealth or privilege. We've committed our lives and careers to helping those most vulnerable in our community, as have all of you. I also heard it stated that there will now be an incentive to select the HMO as a result of this proposal. I would ask you, however, to tell me and my fellow staffers how limiting our provider choices, reducing our covered services, and increasing our premiums and deductibles will incentivize us. The way I see it is that our employees and their families who suffer from ailments such as cancer, juvenile diabetes, multiple sclerosis, asthma, mental health issues, developmental disabilities, heart disease, and other common occurrences like accidents and medical events such as broken bones and injuries will be penalized or punished. I would also like to appeal to those of you who've worked so diligently in your own service to Oakland County, OCHN, and the people in this community. One of our 5 strategic priorities here at OCHN is staffing and retention. One advantage of working here has always been our benefit package, since we know that employees of the behavioral health system are rarely paid what they deserve. I am humbly asking and respectfully begging, please do not approve this evening's employee benefit proposal, as it will have dire consequences for many of us. Via Dana's open door policy, I expressed my fears and concerns to her last week, and I'm now expressing them to you. Please ask our Budget and Finance Department, in partnership with our executive leadership team, to go back to the drawing board and search for other line items that can be adjusted so the impact of our current financial state of affairs is not passed on to us. The effect it will have on many of our lives and families will be devastating. Thank you.
Thank you. Is there anyone else who wishes to address the board this evening in the audience? There being no one, then we'll move on from public comment. And the next item we have is stories that inspire. Oh, I'm sorry. Yep, I forgot. Thank you for the reminder. Need to request the board for a motion to approve the board meeting agenda.
So moved.
Support. Is there any discussion? All those in favor say aye.
Aye.
All those opposed, no. The agenda as presented tonight is approved. So now, we'll move on to stories that inspire hope, and I think Suzanne Weinert is going to introduce our guest.
Good evening, everyone. As you may well know, November celebrates National Family Caregiver Month, and this is a time to celebrate and honor and recognize all the caregivers in both the U.S. and beyond. These individuals, they devote their lives to their loved ones, and they are selflessly in devoting that time and energy to those individuals. Many of you are really very well aware of that. So it's my honor to introduce Michelle Martin. She is the parent of the very talented Elizabeth Martin. Elizabeth has a lot of her artwork throughout our building. You've seen it probably in our traveling art show as well. So it is my honor. I'm actually going to have you go to the next slide in a few minutes so that you can see some of Elizabeth's beautiful artwork. But it's my pleasure to introduce you to Michelle Martin, and they are joining us virtually today, both Michelle and Elizabeth. So welcome. We'd love to hear your story. Michelle, I think that your mic might be muted.
Move her mouse up to the top.
What's that?
On Teams, the mouse goes to the top. Trish, help her. If she's saying it zooms the bottom, Teams is the top to unmute.
Michelle, if you're looking to unmute yourself, it's going to be at the top on the right-hand side,
the second icon from the red button that says leave. It'll be a black icon, looks like a tiny megaphone. Sort of, right? I'm close on that. Michelle, you can also try to hold down your space bar. If you keep it held down, that might temporarily unmute you as well.
You wanna, why don't we do this? Why, since we're having a little technical difficulty, do you wanna try and call her and reach her and see if there's a way we can, well, not right now. I was gonna move on to one other item, and then you can come back and see if we can get it undone. Okay? All right. Okay, so we may hopefully be able to come back to stories that inspire hope. With respect to, oh, we got it?
I think I've got it now.
Okay.
Yep.
Well, that's
All right.
wonderful.
Thank you. All right.
I'd rather hear from you.
Okay. Thank you for having us. This is Elizabeth and Michelle, and I would like to talk about her life a little bit. Through person-centered planning, Elizabeth has been able to accomplish a self-directed life with customized supports. To Elizabeth, this means she chose to start a ceramic and a machine embroidery business with the help of her family, CLS, and MRS, and with her self-directed budget. With the self-direction, she's able to currently have creating different things with CLS. She has been able to be on recipient rights, peer supports. She's also doing right now donating and decorating a tree for Children's Hospital, which she's done for the 8th year for their Festival of Trees, using her ceramics and her sewing. Elizabeth requires assistance to keep her in business, though, and through the help with this help of her self-directed budget, she's able to have help with individuals with procuring sales and help her with the strength that she can't do, different things that she physically can't do. This customized assistance has allowed her to succeed just like most of her more typical peers. To note, Elizabeth has been a customer, or has been a customer of selling some of her things at OCHN, and they have also had her participate in many of their sales and conferences. For me, though, as a mom, my fears and great concerns as a family, we are facing extreme challenges with limited workforce. This makes it quite difficult for people to live these lives they want and desire. When this has worked well, self-direction has been unbelievable, and it's allowed people to choose and support their life and make a very person-centered approach. Right now, families are really feeling the pinch, and many need breaks and support through the voice of advocacy. Most of us are feeling that due to this workforce problem, they need help and it would often threatens their budgets, because what's happened is many times the agency then sees that you're not utilizing your budget, but you're not utilizing it not because of your need, it's because you can't find workers. A budget should always reflect the needs, which is currently the families are and the person's needs. All families are different, and we need to meet their needs and where the families are, and allow them to have the hope and see a more positive future for their loved one. Thanks for letting us talk about it and looking at some of Elizabeth's art. It's really, I can say, it made a difference so much in her life, this business, and allowing her to be part of part of a workforce. It's a very hard time in terms of staff right now. Do you have anything to say? No. She has nothing to say. Questions?
Yes.
I just wanted to congratulate Elizabeth for using her skill set to not only enhance her life, but enhance others through her art, which is a great way to self-express. And I hope you are able to.
Thank you.
You're welcome.
Thank you. Thank you.
Anyone
Any
else?
other questions?
It looks like we don't, but Michelle, I want to thank you for helping us celebrate National Family Caregiver Month. You represent one of the many caregivers in Oakland County, and we appreciate the efforts that you make each and every day, and also in assisting Elizabeth and sharing her talents. So thank you very much. Thank you to both of you.
Thank you very much.
You're
Have a
welcome.
good evening.
Okay, thank you, Suzanne. Yeah. Next item on the agenda is my report. I don't have anything specific except to say that obviously we are working as hard as we can to get the state to appropriate or release appropriated funds in the amount of $52,000 to the various networks in the states. We are hopeful that with the upcoming lame duck session with all the legislators gathered, some of them for their last time, that perhaps we can appeal to the angels of their better nature and have them exercise appropriate discretion to get the department to release those funds because they've been appropriated. There's no good reason that we know of holding up their distribution, and that would help us and help many of the other networks in serving people throughout the state of Michigan. One note for the board that I wanted to bring up, and I'll do it at this time, is we did have a Thursday, November 21st study session scheduled, and the purpose of that was our annual review of board policies, board bylaws, and self-evaluation. However, our compliance officer will not be available to be at the meeting. So my recommendation is that we postpone that activity until perhaps our December meeting, because without the compliance officer, that's who's responsible for these items and recommendations that he may want to make. It doesn't seem to would be a very productive session for us. But what I would ask in the meantime is that everyone, if they have any bylaw changes or policy changes that you want to consider, then we can talk about those in December. So unless there's any objection, we'll cancel the meeting for Thursday. Is there any objection? Okay, then we'll cancel the meeting and we'll move on to December. Sheila, if you'll update our agenda for that meeting. And then what we'll do is, per past practice, since we won't have a executive board meeting, we'll have Sheila put together the agendas for the month and circulate them among the executive board members for comment. Okay?
Dennis, what is the date of the December study session that we have blocked out?
19.
Okay, thank
Right.
you.
Okay. Right. Okay. At this time, we will move on to the business section of our agenda. And the first item we have is various contracts and contract changes that we need to approve. And the first one is BDO USA, their annual contract. They are our auditor, and this is for a one-year extension for services rendered for our annual audit. I'll pass it over to Mr. Young, the chairman of the Finance Committee.
Yeah, Robert, why don't you give the full board 30 seconds on this? Was approved to come forward at the COW meeting, but if you could give kind of a quick snapshot for the other members.
Sure, thank you. Good evening, everyone. BDO has been the auditor for OCHN for the last, I believe, 3 years, and we are seeking an extension of 1 year to continue with that audit firm. We are working on an RFP for an audit firm for the following 3 years for 2025, 6, and 7. But with the other challenges that we're tackling currently, we're requesting an extension so that we don't have to take on a new audit firm and go through that learning process. That's the gist of it.
I know, if I could, Robert, I know you're new to the job, but my impression is that at least the staff was satisfied with the work that BDO has done. I believe, we reviewed it also, and I think we were satisfied.
Yes,
is that the general impression you got?
Yes, all the feedback that I've gotten is that BDO is appropriately diligent and holds our feet to the fire, but they do it in a way that's consultative and has helped us ultimately.
Okay. All right.
Second.
We have a motion by Pastor Jones, supported by John Young, for the audit approval of the audit contract for a 1-year extension. Is there any discussion? Roll call vote, please.
Yes.
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 Yes. Yes.
Yes.
Yes.
Yes.
Thank you.
Thank you. Thank you. Next is the My Strength contract, which is also a 1-year renewal. Mr. Young?
Yep. Is Adam online?
Yeah, I'm online. Can you hear me?
Okay, yes, please. Give us the same thing. Give us kind of a quick overview of it for the full board.
Yeah, thank you. Sorry I couldn't be there in person tonight. So My Strength, now owned by Teladoc, is a software application that we have used for several years now to provide self-management resources to the community. We are seeking to extend this contract for a 1-year term. We're aware the price has gone up. We think it makes sense at this juncture to continue with My Strength because we are in the middle of an NCQA review cycle. This is part of our NCQA approval or accreditation, and we want to continue to have their approval. And we will plan to do an RFP at the end of this fiscal year to explore other options for a software application of this nature.
So I think I heard you tail off at the end, but it sounds like at the end of this extension, there'll be an RFP.
That's our intention, yes. We think it's prudent to do that at this point. We've had My Strength for several years. The price has gone up, as I mentioned. So once we are through this NCQA review period, we'll explore other options through RFP.
Okay, thank you. Any questions from any of the board members? If not, move for approval. Second.
A motion by Pastor Jones, supported by John Young. Is there any discussion with respect to the My Strength contract? There being none, a roll call vote, please.
Ms. Root? Yes. Ms. Newman? Yes. Dr. Hans? Yes. Ms. Woodruff? Yes. Dr. Guadalupe? Yes. Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
The next contract, and I should add for the public's benefit that all these contracts were reviewed at our meeting a week ago, the what we call the COW, Committee of the Whole meeting, by the Finance Committee and recommended for approval. So we just don't pass over these things as they're presented. We have had some due diligence and discussion at the COW meeting regarding these contracts. The next one is MedVercent, and I know from past approvals that they are an organization we rely upon for credentialing of network providers and practitioners, which we are required to do.
Mm-hmm.
So, Mr. Young, if you want to take over on this one.
Sure, thank you. Ms. Marquita?
Good evening. I'm here online. I'm sorry that I'm not there in person. Meferson is our credentialing verification organization. We've contracted with them for several years. They perform the primary source verification for practitioners. They are an NCQA accredited organization, which helps OCHN with our process for becoming reaccredited. Our intent is to RFP this contract out in fiscal year 25. So we are asking for a contract extension for 1 year.
Okay, thank you. Any questions from any of the board members? If not, second.
Motion by Pastor Jones, supported by John Young. Is there any discussion on the MedVercent contract? There being none, a roll call vote, please.
Mm-hmm. Ms. Root? Yes. Ms. Newman? Yes. Dr. Hahn? Yes. Ms. Woodruff? Yes. Dr. Guadalupe? Yes. Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Next is the OCHN Blue Cross Blue Shield contract. Nicole Williams. Is she online? Good evening, Nicole.
I think
you're
I was
muted.
My
Okay.
apologies. Good evening, everyone. I apologize for not being able to join you in person. Yes, we are gearing up and hopefully we'll be planning to roll out our open enrollment for the 2025 benefit plan year. There has been some proposed changes. One of those changes are the inclusion of a third plan, which is a high deductible plan under Blue Cross Blue Shield that gives 3 options for our employees in addition to the existing HMO through Blue Care Network and PPO plan through Blue Cross Blue Shield. In the slider in your packets here, gives a little historical data with respect to prior plan years. And if I could, Robert, if you might be able to speak a little to this slide here.
He's approaching the podium, or so to speak, or table.
Okay, thank you.
So I'd like to begin by just offering some context. Part of the story that I don't know if has been very clear is that the changes that we made were in response to a 14.2% increase to our existing benefit costs. And that translated into roughly $695,000. That's the impetus. So what I'm emphasizing there is that it's an exercise in maintaining our current position and not adding to the losses that we've encountered over the last 3 years. It's ultimately going to allow us to stay where we have been. I also want to clarify, if I may, that we are not passing all of the costs on to employees. We have made changes to the benefit offerings that will cost the organization less, but don't necessarily translate into higher costs for employees. But we are passing some of the costs on to the employees. So I do want to be clear about that as well. Overall, if you look at the slide, you can see where we were in 2024 and that we are at that same $4 million number for 2025.
So we are asking the board to allow us to move forward with the proposed changes for the 2025 benefit plan year.
So we're expecting when you say net, is that net of the employee contributions?
Yes.
Okay. All right. If you could you turn on your...
I'm just a little confused. The net cost is employee, or that's the employer, right? The organization?
Yes, the $4 million is the costs that OCHN is bearing.
Okay.
Yes.
What date do you have to get back with the insurance company by? I know usually it's like the beginning of December for the new year. So what is your cutoff date to have the decision made?
Effectively today. In order to have the plans in place from Blue Cross Blue Shield, we would need to know today, one way or the other.
Okay.
We got Sarah, then Pastor Jones. Pastor Jones, then Sarah, go ahead.
No,
Thank you. No, last week when we had the committee of the whole meeting, I brought up concerns regarding just, again, if you're a family, the increase is about $200 out of pocket for staff. I can't think of the word I'm looking for. What they have to pay out of pocket from the insurance coverage is increased. I mean, so there's a huge increase that's being placed onto the staff. When you look at the numbers, you have almost 80% of the staff who are utilizing the PPO that this is going to fall onto if they continue to do that. I know the rationale that was provided was that we're trying to get folks to go into an HMO, which I just think is concerning, that we're trying to force them into something that could potentially have less coverage, that we're having folks pay that much more in an economy that's already struggling. So we've got a lot that I'm concerned about. We've made top workplaces, but is that really going to continue when folks are struggling financially? The morale, I think, it's going to hit a lot of things within the company. So just wondering, I'm not an expert in contract negotiations and things like that, but I'm wondering how hard did we push to try and see about negotiating prices or looking at something where, this is not going to be a direct hit on employees who could potentially already be struggling with the economy.
So I think that we approach this from a couple of different angles, and there is still a choice incorporated into our plan, and we wanted to make sure that that was the case. Effectively, what we've said to employees is, you can still opt to be in the PPO, but the PPO is a very expensive plan for us organizationally. So if you choose to do that, we're asking you to bear the cost of that. But we're not taking any choices away. In fact, we expanded choices by offering the high deductible plan with the HSA. And I'm not suggesting that that people are not going to pay more. They are.
Yeah. So I'm just curious, though, is there a way to try and go back to the company to negotiate costs to see if that could be reduced?
We could go back and negotiate the plans where there would be higher copays or higher deductibles. But so the pricing for health insurance in the market is pretty commoditized, and the only way that you can negotiate with regard to pricing is around changing the terms of the plans.
Okay, and I know this discussion came up at our meeting a couple of weeks ago, a week ago, what have you, in relation to the increased cost and, of healthcare. And I understand that right now, no matter what type of insurance you have, the cost is going up, whether it's auto, home, what have you. Was there a employee subgroup that looked at that and said, okay, here's what we think, and we buy into it, like gaining some internal support from the people? That's number one. And I understand that you're saying that we have to make a decision today in relation to that. But I'm wondering if there is still room to, survey the people. I know we got a lot of employees, but maybe survey a subgroup of people that say, okay, we've looked at this and yes, this is, and then come back to the company. I don't know if there is that leeway with them. I don't know if today is a drop dead date, okay, or if there is the opportunity to relook at this issue of what it's costing individually. And I know we're going through the same thing that other companies are going through, and people are, and my partner here raised that issue as well. It's a very sensitive issue. So my question to you is, A, one, is today really a drop dead date? That's A. B, do we have time to pull together, and you may have already done it, a subgroup of employees to evaluate and say, okay, yeah, we're in it, and so they too then are the supporter of what we have to do?
Excellent questions. Thank you, Pastor Jones. So to the first question, my understanding is that in the absence of approval or denial today, we will have to go forward with the existing plan. If we don't get approval for the changes, we won't be able to initiate anything significant.
Kawana wanted me to let you know that if we didn't move forward today, we could call a special meeting.
You're saying that if we don't make a decision today, we could call a special meeting?
Yes.
Okay.
So I want to be clear about that, and I'm not sure 100% if this is true, but my understanding, and maybe Nicole, I know you're online, my understanding from the brokers is that in order for us to get these plans in place and have open enrollment for the employees with Blue Cross, we would need to have a decision today.
Yeah, if I could interject. Actually, on the last call that I had with our brokers, they indicated that for a plan year start January the 1st, the deadline is usually November 1st. And so we're actually behind a little in regards to solidifying next year's plans, engaging in open enrollment and so forth.
Well, and there,
What would happen to our employees then?
Well-
Their insurance coverage then?
well, the other problem is there's no guarantee, even if you go relook at something, that you might not get higher prices if you miss the window to sign up now.
That's true as
I'm
well.
talking about with the providers that we have, and that's what I'm concerned about. I mean, look at what I would suggest we do is we need to approve this because we have to have plans. People have to sign up. It's the holidays. We got to get this done. So my point would be if we can look at avenues that we could still make some accommodations, if there's something we can look at, I'm more than willing to do that. But I think knowing I've been through this with other businesses and things, if we miss this window and don't have something in place, and even if we delay a week, we run a big risk of pricing going north, and then we all lose. And I don't want to see that happen. So we have what we have. This is just not an OCHN problem. This is a problem with every employer and for all of us, the rising cost of health care. And so we have to cross the Rubicon tonight, because if we don't, I'm fearful that it's not going to necessarily result in cost reductions, but cost increases, and I don't want to see that happen.
Brother Chairman and others, and to you, Robert, is there, if we do approve, is there a cancellation penalty? I.e., again, I'll go back to a subgroup looking at that of employees and, okay, buying into the plan. I think if we get the buy-in, that's important. That's really what I'm after. So the thought would be that if we have to do this today, if it is drop dead date, and we say, okay, we got to do this, and that's to hold the pricing, hold the level. But then, is there a cancellation cost to us if we come back after we've done a survey, what have you, and found, wait a minute, we could do something different or better? That's all I'm asking.
So I'm going to take that in a slightly different direction, because if we do a survey, I live this, we just did our benefits, everybody wants them cheaper. But one of the things we've had to do, and we've got 5 different unions, so it gets really exciting. These are all blues plans. What about Priority Health? They're growing like gangbusters in the market, and I'm assuming 99% of our employees live in Oakland County, maybe 98. Did the broker compare just blues plans? Because no offense to the blues, but they're usually the most expensive. Or was there a comparison to Priority Health, Health Alliance plan? It's about all that's left in the marketplace.
If I can speak to that, and in all fairness to both Robert and Nicole, and our amazing team that pitch hit when we lost our HR director, they're coming behind the 8 ball, so to speak, and we did not get this information actually from our Assured Partners, which is our vendor for doing the benefit shopping for us and comparisons. When did we get it, Glenda, you remember? Because it was later in the October, I think.
Okay.
And
yes.
so...
I can respond to that.
I'm sorry. Oh, I'm so sorry, Dr. Hahn.
No, I just had a question about how is the employee portion calculated? Is it a percentage of the cost of insurance, or how do we figure that out?
It is.
And what is that?
There's varying percentages for the different plans. For the PPO, I believe it's 27.5% and 20% for single and family plus.
And is that for we do that every year, or is it for this year?
No, that was an increase to the PPO share this year.
We also had an increase last year, but it was much smaller. And one of the things that is really unique about our benefits, and believe me, this is gut-wrenching in terms of making these decisions and these changes. I would love to continue with the package that we have, but when your HR director and your new CFO are advising you as to how we address some of the challenges we have, it is to look at the premiums and the rates of the premiums. And so, believe me, we had some very, very interesting debates in trying to find ways to really look at this and chop it up to see where we could continue. And one of the biggest things is that we cover, if not all, most of the deductible. And so that out-of-pocket cost limit is the thing I think is most shocking for our team members. And then I also think some of the co-insurance that we're looking at is also very shocking for our team members, particularly our team members that have families that do have a higher need to utilize those benefits. So we wanted to offer another option as a savings for those individuals who could, that high deductible plan. But I think there will be few people who take advantage of that. And then with the HMO, which is the more, I don't think it limits options. You do have to get referrals in the HMO. But I do think that there are some families that of our staff here do have some very challenging medical things going on. And so it's really hard to say, where do we make some of these changes? And again, we've gone over it, over and over it. And so when we had our staff meeting last week, we could not fully present the packages because we didn't have all of the information yet from Assured Partners. And we had to actually go back to them and get clarification on a few things. So we did allow for our team, our staff, to refer to an online form and ask questions and get responses. So we looked at that also to see where can we further explain, but also where can we make some exclusions or some changes. So one of the things, one of our team members said that why can't we do this at the end of the year instead of now? And we have to do some changes now because we're looking at our finances every month in this meeting, and we know we are having some challenges. But my hope is, and of course we can never promise anything, but I did charge Robert with, you know, if we do a turnaround in this next year, is there something we can do to put this coverage back? To say that we can, at the end of the year, maybe look at ways to reimburse families back for that cost. And again, we can never promise that because we know we have statewide challenges and both our own local challenges, but I want to be able to make the families whole because, again, it's very difficult. It's easy for me to sit here with my salary and say, okay, this is an increase, but I do recognize that our team, the bulk of our team, does not have my salary. And so, in all fairness, I really pushed back, we all pushed back quite a bit to, Robert was at a point where, you know, it's like, okay, I'm just giving you the numbers. So, again, we really want to keep looking at this, and I know there's a decision to be made, and I also know very clearly that I'm almost glad it falls on this board, honestly, because it's not the decision I wanted to make. It's a decision, a business decision we had to make because of where we're at right now and the increased cost of health care services and insurance.
Did anyone else have any questions?
I think Ms. Ruth has.
Okay. Oh, yeah.
Thank you. I want to go back to why you said Assured Partners did not give us quotes. For Mr. Young asked about other insurance agencies, and I thought I heard you start to respond with Assured Partners didn't help us or provide.
No, I started to say that I wasn't aware whether they did or not.
Oh, sorry. Okay. So does anyone know? Because on our board packet it says specifically that Assured Partners is supposed to help us with quotes.
I don't know the answer to that question.
So I you know, what a great discussion tonight. I guess what I'm trying to find out about wiggle room, okay, if that's a good word, of what we do now and what we can do later, okay? That's really what I'm interested in that as we implement this, one, again, is there a penalty for getting out of the contract? Number two is there another alternative, you know, that we would find or that we can search for over these next 30, 60, 90 days. So what is it that we can do? Because we may have to accept this, okay? If I accept your drop dead date. But what other opportunities do we have to revisit this? And again, thank you, Madam Chair, for saying that you have sent out surveys among the people, but is there a subgroup that can further explore this as we try to find some other alternative?
So you're teeing, I'm going to amend again. I know we're running out of time. I know there's what I would be comfortable with, because we deal with brokers too, and I can remember sitting in this very seat a couple years ago saying, how did you get those low rates? So I know they're capable My question is, and I'm not going to be comfortable until I hear an answer, either today or soon, there are other plans are we locked into Blues? Are we as a state organization? Why is it only Blues? Did we get dropped? I mean, a Health Alliance plan is brutal about dropping accounts, so I know that. But I know from a lot of experience, Priority Health is growing, and could we add 2 more options? Because the cancellation and everything, no offense, scares the crap out of me going forward. It's not, we have an overall, but each individual is going to have essentially an agreement. So I don't want to get into that, but I would like to see other options. I can't believe there's only 3. And I know you're new to this, and the HR piece changed, but that's why we pay a broker. And I just think they did a B- job.
I don't know whether they got other quotes or not, but I can find that out. So I don't. The answer to the question of whether they did or not is I personally don't know, but they may have, and I can find that out. If I may, just one response. So I don't know what the implications would be to the plan, but we have many options at our disposal in terms of compensating employees, right? So to Dana's point earlier, if we were to have a financial turnaround, I think that there was staunch advocacy during the conversations of the people who met about this change on behalf of what the impact would be to employees. And I thought it was very healthy and certainly due, right? Like we owe that to the folks that are committing themselves to the work that we do and the people that we serve. I think we've gotten a proxy survey. I think that there's a lot of folks who are not happy, and I understand that because it's loss, because there's a cost to it. Financially, I'm not sure as the CFO what to do about multiple years of $15 million losses. Like at some point, I feel like this is the responsible thing to do for the future of the organization and the employees. It just doesn't feel like that in the moment. So if we were to have a banner year, a turnaround, I feel very confident that as a group, we would be looking for ways to return some of this money to the folks that we're asking to sacrifice.
And I understand that. My effort is, and I do agree with my partner here in relation to other options if we have them. I understand the shortness of timeline with your being new in the position and our HRM person being new in the position. I understand that. And we may not have any option today. Okay, I'll accept it. But I'm looking to see how do we get more people in the boat with us on it. That's number one. Number two, as our CEO has said, we can't promise something if we don't have. Okay, and I would certainly not want to be the person sitting here saying that we promised you that we would do this, and then we'd have another group of upset employees. All right. So my take is, but what's that word? It is what it is. I guess that's the thing. It is what it is at this point. But we really need to do, as my partner said, how do we look and see if there's something else available? I know you're going to do that. If that's it, fine. And then maintain that employee group that's working with us on this. To say, how do we do this? Because they're looking at other things as well. I mentioned home insurance is up. Automobile insurance is up. Okay? A lot of different things that impacts you when you put all the numbers together. So that's a concern. Get them in the boat with us. Make sure that they understand we're trying to do the best for them as well. Thank you. Thank you, Mr. Chair, and thank you, Madam CEO.
Since Kawana said we could call a special meeting, if this is possible, I'm wondering if the board would support HR contacting Assured Partners, seeing what other quotes there are, and then we could meet Thursday because we already had that time set aside. I don't know if it's possible to get quotes in a day and a half, 2 days, but if that is possible, that's what I would be comfortable with. Otherwise, I'll probably have my vote be no for the record tonight.
I would agree with Christina. I
This
mean,
is
if we're at
this is a pretty complex issue. This, when you change, I've been through a plan change where you went from one provider to another. Those are never simple things. I'm not arguing. I want to reduce the cost. And I think in the past, we've had some years where we were lucky a couple of years that it was flat, as you saw from past history, and that was a benefit to everyone. But the problem we have right now is that I can add, to go, first of all, I don't think we're going to get a quote in 2 days on something this significant. And again, I'm very worried that if we delay in signing the contracts, that costs could go up. What I think perhaps a prudent way to go is working off of what Pastor Jones just said is we have to move forward with this because we are really, I believe, at a point of no return. What we also have to do is try and get a working group, which would probably involve some employees along with our staff, to try and find where can we go to cut costs in the future, and can we as a board, I believe, would make it a priority that if we have, we either find cuts we can make that would supplement this in some way that you mentioned about reimbursement. We can't make any promises but I think that would be a route to go as a follow-up from this point, and get some coherent strategy going forward. And then for next year, I mean, that's a short-term plan, but for next year, we have to go and broaden the scope of what we're looking at. But we also have to prepare everybody that when you make a plan change from a provider, the major provider, there's a lot of other issues that come up because it's all in the fine print. And you may get a lower cost, but you may get some limitations elsewhere. So I think we have used Blue Cross. I'm not an advocate. I don't have any tie with them. They're my provider at my employer. But I think the right way for us to go tonight is to approve, work on trying to find ways to see if we can supplement with some assistance, if we can either make cuts or other options, and then also look for making some changes into next year that would be a reduction in cost.
And I think that if we do that, the employees would be happier as well, because then they would be part of the process.
Yeah.
So if we could do that and say, okay, because even if we do this, working through, we may find something that we missed, some other opportunity that's out there that we will be able to take advantage of. And then it may be, and I don't know how long terms can be, I think we just extended some other term, that sometimes a longer term commitment may help us. Don't really know, but at any rate, let's look at some of the options and see what we come up with. Thank you, Mr. Chairman.
All right. All right, I'm sorry.
I just want to be clear about that there is an increase in the employee part of the premium by 27%, or is it?
No, no, it was about a 5% increase. It went from like
5%.
22% to 27.5%.
And what was it last year? Do we have those numbers?
I don't know what the dollar amount was.
No, the percentage.
Roughly 22%.
Okay, thank you.
Sure, go ahead.
I'm not sure I'm 100% sure if we can do this or not, but if there's a way that we can change the employee portion, is that something we can do on our own, or do we have to go back? I'm looking to Nicole and Robert. Is that something that we can go back to as we monitor our financial situation? If we see we're in a trending to do better, is that something we can do mid-year in terms of the employee's portion of the contribution to the payment for the insurance?
Yes, yeah. I mean, that's our decision. We would work with ADP to make the changes.
Okay.
We could also modify the deductible contributions.
Okay. I just wanted to make sure that was on record too, because I think, like you said, we didn't do a formal survey. We did collect feedback from our staff when they initially heard about this in a staff meeting. So they didn't get all the information, benefits at a glance and things like that. And we can't provide it until we actually get it approved for a contract. So I just wanted to make sure that it was clear that internally as we work on this, there are things that we can do when we see our financial picture brightening, and that is always our goal, to make changes to how much the employee would have to contribute to the insurance premiums.
Yes. Oh, yes, Malchiah.
I make a motion that we accept the Blue Cross Blue Shield contract for the employees with the changes that have been discussed.
Okay. So there's a motion by Malchiah Newman. Is there support?
Second.
Support. Okay, so the changes, it would more be an approach, would be that we would look for ways to lighten the burden in terms of the employee contribution, with the goal to see if there's financial performance overall in the organization, or specific cuts we can make elsewhere, or changes that we could reduce that, and the goal would be hopefully by the midpoint in the year. So and then to look into, have HR do a more comprehensive approach earlier, so that we can see, are there other options other than Blue Cross Blue Shield, and if we get some more competition, would that provide us with some cost savings? And taking into account too, what changes a new plan would have if that were I call it the primary plan.
I don't think we need to switch. We're big enough that we can have 2 or 3 plans. So the total switch would be chaos. Okay. I think we're large enough that there can be the Blues and a Priority Health. 10 years ago, the answer would have been no, but everybody got hit hard this year, which has pushed people toward multiple, and it's hard on the finance folks, and it's harder on the human resource folks. But I just think we need another, we can have 5 options. When I used to work in healthcare, we used to have 7 options. It was crazy. But on the other hand, every year you figured out, what do you think you were going to get hit with medical? So I add, not change.
And I think that would be covered under the subgroup, as they look at that and see what other options are out there. So
right. If we can add options for next year, that would reduce costs.
Yeah.
And I will follow up on the question about whether the broker included other groups besides. I will get you an answer to that question.
Thank you.
Yeah. All right. Is there any further discussion on the motion? A roll call vote, please.
Ms. Root?
No.
Ms. Newman?
Yes.
Dr. Hans? Ms. Woodruff? Dr. Guadalupe?
No.
Pastor Jones?
yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes. All right, we're going to move forward with what we have, but with the study and the approach of working with our staff and employees to see if there's ways we can reduce these costs and perhaps have some reimbursement discussed at the mid-year point. Okay. All right, thank you. The next item is the Public Act 152 resolution, which is a standard resolution that we pass every year, that's also been passed by the Oakland County Board of Commissioners with respect to exemption from Public Act 152, which allows us more flexibility in our budgeting with respect to medical benefit plans.
Okay, Nicole, can you give us a little overview?
Sure, he absolutely. So the Public Act 1, he did a great job, great job. It actually limits the amount that a public employer can contribute toward the employee's medical benefit plans. And as mentioned, since 2011, I believe, the board has approved OCHN's ability to opt out of that cap or that limit, if you will, so that we can offer a more comprehensive and competitive benefits package, put us in a better position to recruit and retain staff. So it really goes in line with the previous discussion. Um, and so again, we respectfully ask the board's continuation in supporting our ability to opt out of PA 152.
Any questions from board members? If not, I will make the motion to accept.
Support. A motion by Mr. Young, supported by Pastor Jones. Is there any discussion? Again, this is something we have quite frankly passed every year, so we'll go for a roll call vote.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff? Dr. Hans? Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you.
All right. Our next item is the fiscal year 2025 PIHP contract, and this is Kalana. Assume she's on virtually. Kalana, you
I'm
want to
here.
cover this?
Yes, sir. Kalana, Senior Legal Counsel for OCHN. What was presented at the COW was our fiscal year 25 PIHP contract. If we can go back one slide, it was in the amount of $408 million approximately. This contract allows us to provide the Medicaid cover services to the 26,000+ residents of Oakland County.
Could we go back to our item on the screen?
Thank you.
Because that's not, okay.
We have two.
All right, good. Thank you. Thank you. Okay. All right. And this is a contract with the $408 million, which is our primary contract with the state, correct?
Yes, sir.
Okay. And this includes the clauses that we've had some discussion about that we object to?
Correct. We still maintain our objections. However, we are executing the agreement as presented by the department at this time.
Right, right, okay. All right. So this is our primary contract with the state of Michigan for $408 million.
Any questions from board members?
Yes, I'm sorry, yep.
If not, I'll make a motion to accept.
A motion by Mr. Young, supported by Pastor Jones. Is there any discussion? Roll call vote, please.
Ms. Root?
Yes.
Ms. Newman?
Yes.
Dr. Hans? Yes. Ms. Woodruff? Yes. Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Motion carries.
Next, we have for our fiscal year 24, which for the fiscal year which just ended, we have contract amendment number 3. Kalana?
Thank you, sir. This Amendment 3 adds an additional $6.5 million to the fiscal year 24 contract. This amendment updates the capitation rate methodology as well as the CCBHC supplemental payment capitation rate methodology.
Okay. So is this, since the fiscal year is already over, was this change already made by the state during the course of the year, the fiscal year of 24?
So this is my understanding is that these updates were made post-close fiscal year, but remember that they're still settling the fiscal year for 24. So like previous years, we've had additional amendments at the end of the fiscal year where additional funds were added to the agreement to balance what should have probably been paid out during the year.
Okay. All right. I'm gonna state the obvious here, and I'll ask somebody from finance to take a look at this, but the total contract we had with the state on this primary agreement last year looks at about 442 million, and the one we just approved is for 408. That's a pretty big difference. That's almost 10%, and that's in the wrong direction. So yes, Mr. Blumenfeld, if you could come forward and maybe, I mean, I know that's not the purpose of the amendment, that'll be approved, but it jumped out at me in looking at those two figures.
Sure. No. For context, one of the things that we've seen is redetermination of many people out of the DAB designation into other designations, and that is a significant change to our revenue. And also, as I think this board knows, we are funded based on enrollments, and enrollments are down. So it's kind of a double whammy.
Okay. So is this 34 million offset anywhere else with people going into other forms of care?
No.
No. Okay.
No. We're actively seeking grant funding, but
Okay.
it's not. No, this is a hit to the bottom line.
Okay. Yeah, I think we knew this from the budget, but I kind of wanted to emphasize it. And if maybe you could let us know for the next meeting, where does that fall in with what we budgeted for the year, for
Yes.
the coming fiscal year? Okay,
I'll be
what we
prepared
just
to
approved,
report on that.
the
Yes.
408. Okay, thank you
Okay.
very much.
Thank
Appreciate
you.
you coming forward. All right, so we do have budget number 3 with some good news about a settlement, or not a settlement, but amendment that would assist with last year. Do we have a motion?
I'll move for acceptance.
A motion by Mr. Young, supported by Pastor Jones. Is there any discussion? Roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Cowan?
Yes. The motion passes. Thank you very much. What's that? Yeah. All right, next business item we have is the Recipient Rights Advisory Committee appointment recommendation. Vicki, do you want to come forward, please? I believe this was reviewed at the COW meeting. Want to give us a brief overview of our candidate or nominee?
The RAC has one vacancy, and we interviewed one candidate, and unanimously, the RAC committee members recommended Amy Kupovitz for appointment to the RAC committee. She is very familiar with the rights system, the rights in general, and has been a long time and fierce advocate for individuals with disabilities as well as for rights.
Thank you. Do we have any questions about the nominee? All right, I'll entertain a motion.
I make a motion that we accept Anne Marie Kupovitz for the recipient rights vacancy.
Is there a motion by Melchiah Newman, support by Yvette Woodruff? Is there any discussion? This is a roll call vote.
Ms. Root? Ms. Newman? Dr. Hans? Ms. Woodruff? Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Motion carries. Next, we have the consent agenda for meeting minutes of our various committees as well as the board, and as well as receipt and file of the September monthly financial report. Do we have a motion?
So I'll make a motion, but I'm going to remove the receive and file so Robert can give us an update on the
okay.
financials.
All right.
So I'll move for approval for the other items.
We'll remove
A and B.
the financial report, and we'll talk about the other, and just include the board minutes. Is there support? Motion by Mr. Young, supported by Melchiah Newman. This is just a voice vote, right?
Yeah.
Yes. There's no discussion on consent agenda items except the removal. So all those in favor of the motion say aye.
Aye.
All those opposed? The motion carries. Okay. Our
All right,
financial report.
Robert, can you give us update on the monthly financials, which I think the report was through September 30th?
So before I get to the slides, just super high level, we're anticipating a loss for the year of about $15 million. That includes some cost settlement numbers that are yet to be finalized, so there is some potential upside there. But the degree of that is indeterminate. I don't know if there are going to be slides put up, so I'm going to walk through this and ask you to follow along in the information that was provided. You can see for the MDHHS payments, the trend over time, it was relatively flat, about $30 to $31 million per month, and the vast majority of that was Medicaid funding, which is impacted by the determinations that are made in the enrollments that are approved. To that end, if you look at the eligibles slide, you'll see that consistent downward trend from the beginning of the year through the end of the year in terms of eligible participants. Our overall asset picture for the year shows a decline in cash and investments of about $14 million. Receivables were relatively flat, and our capital assets changed by about $2 million, which is predominantly depreciation. On the liability side, we had an uptick in our vendor payables. The majority of the rest of the liabilities remained relatively flat. Long-term debt was down about $1.1 million. And our overall net position changed from about $50 million to about $32 million. If you look at our revenue year over year, we were actually up a little bit on the Medicaid side, $453 million versus $435. The rest of our dollars were relatively flat, about $1 million more in state general fund and just over $2 million in other funding, which is predominantly those grants I was referencing earlier. Our provider network expenses were up about $22 million. Our administration was up about $2 million. And our grant expenditures actually went down by about $11 million on the expense side. And again, the net income comparison, our revenue was slightly up, our expenses were up a bit more, and our overall net loss for the year is projected at $17.8 million. And then the last slide just shows our top 15 providers, and you can see that the lion's share of those services are provided by Easter Seals Mork, with CNS a distant third. and CLS comparable to CNS in terms of overall service delivery and expenditures.
Okay, thank you. And I know you gave a report at the cow, but just a little synopsis. We appreciate that just for the benefit of the public and as well as for the board members who weren't here. Any questions? Yes.
Go ahead. Well, maybe for Nasser, I guess concerned is the word redetermination ended May, June, and numbers are still going down. I find that troubling, but is that, I don't know, it's troubling, I'll leave it at that. I just was surprised, I thought we'd stabilize once we hit June, July.
We did also. We are looking and working really closely with the Community Mental Health Association and really advocating for a review of those redeterminations. We have some preliminary numbers that we've been looking at over the last 5 years, but before we present it, we also want to make sure that we fully vet it before we present that to this board and share that information. But we see some decreases in the last 5 years, and it's individuals who were at one time considered disabled, aged, and blind, or DABs, who are changed to other categories to TANF, which is Temporary Aid to Needy Families, Healthy Michigan, they're on a Medicaid spend down. So there's been some drastic changes in how we're funded for those eligible members. And so we're really looking at that. In one county or one region, I'll say, they shared some of their findings after a group of advocates really wanted to see what's going on with the finances. So this is a statewide problem, but in this one particular region, which is probably half of our size, they found that they had lost $33 million since 2020 because of those changes in categories. So we definitely want to bring that to this board's attention, but also have a real firm grounding on what we present to make sure that, there aren't holes to poke through it or something of that nature. It's obvious something has changed drastically about our funding, and it's just not coming out of the public health emergency, and it's just not the redeterminations. So we're looking very closely at trying to figure out why this is happening.
Yeah. I'd like to ask a question. I know we've talked about, and I may be asked the wrong question at the wrong time, in relation to, I know we talked about standardized billing and pricing, but the other thing, and I'm sure we're doing evaluation of our providers and contractors, that are they reaching expectation? Are we paying for something that we're not getting? Or what? Are they? I hate to say any of them stretching the service options or what, but I'm just wondering if inside of this, are there any leverages? Are there any leverages? And I don't know. I may be asking the wrong questions at the wrong time.
Yeah, so one of the things I'm personally very excited about is the work that we're doing around moving from the service models to the fee-for-service reimbursement, and I think that that's going to have some significant positive effect on our bottom line.
Thank you.
The other thing I'll say, Pastor Jones, is during the pandemic and during the public health emergency, one of the things that we were charged with was to ensure provider stability. So what that meant is that we paid our providers at cost. We cost reimbursed for the costs that they reported to us through the financial statement status report, FSRs. And so now we're moving to more of a claims-based system. So when a service is provided, the provider will submit a claim, we'll adjudicate that claim, and we'll tell finance to pay that bill. So I think that's a huge adjustment for our provider community, where they were accustomed to receiving provider stability payments. If we had any extra dollars, we pushed them out as much as possible. And I think, in some ways, I really think it's really critical that as a system, as a community, we come together and advocate at the state level as to, we have to pay our providers. This is the front line of our system as providing those services. And if we're underfunded as a system, it makes it very difficult to increase rates or pay rates that, they're used to getting. So the standardization process that we talked about in the fee-for-service really does say that there's equity, so that providers who were making more are being reduced, and that's a challenge for them, but providers who were making a lot less are being brought up to that, so which is a good thing for them. So I think we're hearing from our providers because of that change.
Thanks, Robert. So I'll make the motion to receive and file.
Motion to receive and file the financial report. Support by Pastor Jones. Any discussion? All those in favor say aye.
Aye.
Aye. All those opposed, the motion carries. Next, we have board reports, the Citizens Advisory Committee. Christina Root.
Our previous CAC meeting was held on October 16th. We had the pleasure of hearing a presentation from guest speaker Bob Sheehan, who is the CEO of the Community Mental Health Association of Michigan. And he just provided updates on state policy issues and advocacy efforts. He, of course, addressed topics that all of us in this room have been discussing for the past year, including Medicaid shortfalls, worker shortages, and then employee wages. And our next meeting is scheduled for tomorrow at 9:30 a.m. Thank you.
Thank you very much. Recipient Rights Advisory Committee. Dr. Guadalupe, was there any meeting to report on?
There was a meeting on November 7th. Unfortunately, I was not able to make that unexpectedly. But the next meeting is December 5th.
Okay. Thank you. And our oversight policy board, Sarah May, isn't here this evening, so we don't have a report on that. All right. Next, we have second opportunity for public comment. Is there anyone online?
Is there public comment online? If so, raise your hand, please. Sky Montforton.
Hi, yes, thank you very much. I realize I only have a short amount of time to make this comment, but I'm going to make this request humbly, and I beg you for the board to either revote to suspend the vote until Thursday, so that an emergency employee advisory committee can be put together, as well as an employee survey. We were never informed that this was going to change. We were never informed that deductibles and co-insurances were going to now be our responsibility. For a lot of us, myself included, the last 2 years, I'm a cancer survivor. Without having the deductible and co-insurance paid, I would have literally lost my house and gone bankrupt and been homeless. I think that more attention needs to be paid to the employees as a whole. I can speak for myself, and as well for some people, we feel that finances are coming above and beyond the appreciation and for all the effort that we do. We were never given a survey. I'm not sure where this proxy survey came from. We were not informed, either verbally nor through any type of written correspondence, that our benefits were going to change in such a drastic fashion. And so I humbly request that a revote is done to suspend the vote until Thursday. I know that was given as an option so that we can put together an emergency employee advisory committee, as well as send out an employee survey. That's all I have.
Thank you.
Is there any further public comment online? No further comment.
Okay. Is there anyone in the audience present here who wishes to address the board? There being no one, we will close public comment and we will move on to the director's report. Dana?
Good evening again. And this month, I just want to highlight a few things. And one is the veterans, our veterans program, and the service we provide to veterans and their families in our county. We're quite proud of, even from the state's feedback, we have the best veterans navigator in the entire state, and I have a tendency to agree with that. We have had presentations here at this meeting from our veterans navigator and seen the impact that they're having on the lives of our veterans. So very proud of that. Also, we also take this opportunity to celebrate the resiliency and dedication of our families that serve as caregivers for individuals. And I also want to thank Elizabeth and her mom, Michelle. They've been at many activities with us and always very engaged and have the most wonderful, I think I spent a few dollars at Michelle's and Elizabeth's, I'll say, booth when she's selling her amazing items. And it's always good to see because there are others that are involved in their businesses, and we have to, you know, take advantage and really support those businesses because they are amazing. The last thing I wanted to say, well, not the last, but I did wanted to announce, and I know this is, you know, a little difficult because we were voted one of Michigan's top workplaces again, and I know with all the changes and the things that we have to do to it is a stab in the heart to not be able to think that we won't be in the same position next year to be able to, you know, even be a runner for top places to work. And my hope is that as we continue to work on the fiscal, the financial situation, and really advocating for the people in this community that we're responsible for serving, that we are funded in a way that allows for our providers, our person served, and we heard Michelle, Elizabeth's mom, talk about self-determination, how important it is that people have self-directed lives and they make decisions about the care that they receive. It gets to be challenging when you cannot pay direct care workers or you can't pay a competitive rate. So we have to continue to advocate. So I do have a section in my report that's really dedicated to talking about the Medicaid redetermination and the challenges that we've had since, but also advocating and continuing to advocate with our provider partners as well as the local community, the county, and at the state level with our legislative consultants. We indeed have a meeting with them on Thursday to talk about some more of our options, but also meeting regularly with our PHP partners to make sure that we're looking at the data and looking at the impact it's having on our ability to pay our providers. A lot of mandates that we're seeing now are unfunded, so we need to continue to advocate at the state so that we can receive the appropriate funding. And I know it's really hard to come to a meeting where you have a lot of not so good news, but I do want to acknowledge the hard work of our team, and I cannot disagree with what was said about the work that we're doing. We continue to provide crisis services. We continue to have our co-responders and our CIT trained officers, and our partner today, 20 years celebrating the Alliance and the amazing work they're doing. So I wanted to highlight some of those amazing things we continue to do because I think it gets hit when our team hears from others that they're not happy about certain things that are going on. And our team continues to be dedicated and provide those supports and services and work with our provider partners and the community for those things that are funded by Medicaid, but also those local funds that we are in partnership with the county to be able to provide some of those services. And making sure that we can continue to provide those services ongoing because they do benefit the community and they're great values. When you talk about even Pastor Jones this morning in his Greater Pontiac Community Coalition meeting talked about the number of lives that are being saved through the Alliance and their partnership with our county sheriffs in the crisis response unit, and also through the administration of medication to stop overdose deaths. So we're really proud of the work that our team is doing. And even today, going to sign a resolution with the Oakland County School District, as well as other partners in the education arena, signing a resolution or a proclamation that we continue to work together. And I have to give kudos to our school mental health navigators. Christine Burke and I couldn't even leave the building without many of the educators and our partners talking about what value our school mental health navigators have brought to this community and the difference they're making with making sure that administrators, teachers, students, and their families are getting connected to mental health services by just coming to the schools and presenting information and linking people. We have expanded access in that way. The other thing, and finally, is really working with our community to make sure that when we make decisions that impact how we pay our providers, that we're revisiting these things. And it's really, really important that we continue to work on those partnerships because we cannot do it without our provider partners. And I think we know that right now there are some challenges, but I really wanted to focus on the good things that our team is doing and working with this community because we know that we cannot do it alone. With that, I think that's, one other really good thing, and you're always hearing about our recipient rights team and our customer service and the amazing work that they're doing. But I will say at this recent review that they had, we are in full compliance with the state's assessment for recipient rights. That is amazing. I want to give kudos to Vicki and her entire team as well as Miss Linda because they're all working together to make sure that individuals we serve and their families are truly have a voice. And if they have a grievance, if they file a recipient rights complaint for whatever reason, our team is out there making sure that we're taking care of the people we're responsible for. So please join me in saying thank you to the recipient rights team under the leadership of Ms. Vicki Suter and our customer service team. It's huge. So often you get a little pushback. It's like you're not quite there, but this team really did pull it off, and they had no pushback. They were approved the first time through, so that's amazing. So thank you for that. And that's all I have. Thank you.
Does anyone have any questions for Dana? All right. Thank you for your report. Thank you. Next, we have board member comments, and I'll start with Mr. Furman.
Good evening. I'd just like to, again, thank all staff members who took part in putting the information together for tonight's meeting. I'd like to thank the Stories That Inspire. It's always very uplifting to see a member of the individuals that we serve use creative talents to assist and just brighten the lives of others. I know that that's a activity that I always encourage other people to engage in is anything creative, and it's wonderful to hear that that's being done. I thank my fellow board members for the spirited discussion tonight about the insurance plan options, and I'd just like to let the public know that we heard the discussions from last week regarding transportation, and that's something that I hope that we still endeavor to take a look at. Thanks a lot and have a great night.
Thank you. Dr. Hans?
No comment.
Okay.
No comment.
I just have one quick comment. There was a time when the board would give a stipend to the association. And I don't know why we stopped doing that, but I'd like to see us to resume it. We depend on the association a lot for our advocacy and different things. So I would like to bring that before the board. I don't know if we need to discuss it. Like I said, I don't know what caused us to stop, but it was routine to do it once a year to the association.
I thought that was individual, and I have been giving annually.
Okay. Well, the rest of the board needs to catch up with you then.
I can find out when the PAC donations are happening. I think they're spring, but I could be wrong. But I'll find out when the PAC campaign is
Okay,
happening.
thank you.
Thank you. Christina?
There's a cheesy quote stuck in my head, and that is, "Diamonds are formed under pressure." So I just encourage us to feel hopeful and proud of us for being a strong board. It's a healthy sign when we have long discussions, even though it gets late and we get sleepy and hungry. But yeah, we got to have some of that pressure ourselves as board members and then as leaders of the organization. Thank you.
Sarah?
No comment.
Pastor Jones?
First, I really want to thank the board for what you do, the tenacity, the pushbacks. I appreciate the pushbacks and the ask, so I thank this board for what you do. And then for the staff, in these times, I'll piggyback off of what my partner says, Ms. Root, what makes a diamond? Heat and pressure. And that's really, we're going to come through this because we've learned to deal with the heat and deal with the pressure. But, what I've seen from the staff and the employees here is it's not a what if, it's how can. And that's the thing that you continue to demonstrate. Not what if we can do it, but how can we do it? And we're going through a period of time when we come together to see, okay, how can we do this? I heard a saying some time ago, we have done so much with so little that we can do almost anything with nothing. And very frankly, that's where we are today. So thank you, Mr. Chairman. Thank you, Madam CEO. And thank you, my fellow partners on this board.
We're switching. I can't follow you anymore. So I'm going to go practical since that was a beautiful sermon, Pastor. For Robert and our HR team, I would challenge the brokers. They're used to this situation if they work with any form of public entity. Same thing happens at the university. So I would even go back tomorrow and challenge them about, like I said, the insurance companies are competing. The brokers are supposed to bang their heads against each other to get the rates. You're canceling. I'm going the opposite direction. I would ask to look, can there be a mid-year addition as well? We're talking about giving back money. I hope that can happen. I've been around the block too many times to know how challenging that is. But if there's a way to add a fourth and fifth option, even if that's mid-year. So on the employee committee, I hear that, but I think where you've got to zero in on what are the important benefits. Everybody wants a cheaper, if you all find a cheaper plan out there, call me right away because, I'll bring it back to my place too. Everybody was double-digit rates. So I think that let's see what are the key benefits here. And the broker should be able to look at that. And then the last piece is, we do a lot of talk about advocacy at the state level. We got to push on it. A lot of the big noise needs to be geared toward the elections are over. There's money sitting there. There's all kinds of rumblings going on. Everybody's asking for kind of nickels, dimes, and quarters. If it goes that way, we're going to continue to struggle. I think some of the groups have got to come together. Everybody going to Lansing independently, and trust me, I see it because I get my emails are full of parents groups, school groups, healthcare groups, mental health groups. And I look at it and go, 18 people walk into a state rep's office. They're all told, yes, that's a great idea, and 0 for 18 get funded. So we got to get together more on this and coordinate so that we can move some of this money. So thank you.
Just to play cleanup here. Part of our being board members is making difficult decisions. So we had a healthy healthy discussion, and I appreciate Christina's positive remarks. That's a sign of a healthy board. But we faced difficulties before. We've overcome them. But we seem now to have a significant resistance to increasing funding in the mental health sector, and in fact we're having a decrease because of the continuing redetermination, and we're going to have to make people listen. That's what our job is. So that's what John just referenced. We're going to have to make people listen, the decision makers, because we run a very lean ship here. We only have 6.5% administrative cost. I'll match that against any other group, and certainly against any kind of nonprofit group, whether it's in a public or private sector, in terms of that performance. So we're not holding on to the money, but the one thing that gets forgotten in all this is that demand is still high. Demand coming out of COVID uncovered a lot of needs that people have, and those needs are continuing despite the fact that the funding is dropping precipitously. So we're going to have to redouble our efforts to make people listen. I would like to note and thank Michelle and Elizabeth again, and remember all the caregivers that we have in Oakland County. Many people at this table are caregivers, both board and staff, as well as all those we know, and to keep them in our thoughts and our prayers as they deal with the struggles each and every day, and also the joys that they have as well. So I'd like to wish, I think all of us would like to wish a happy Thanksgiving to all those we work with. There is a lot to be grateful for. And finally, just on a lighter note, there's a great movie coming out this weekend, Wicked. I would strongly encourage you, if you want to escape for a couple hours, to go see it, The Pink and the Green. My family, we've always been big. We're going. We got a whole evening planned Saturday, a lot of fun. So I would encourage you, if you want to escape for 2 hours, you've got the pink, you've got the bright pink, the Good Witch. That's the color of the Good Witch. But it's phenomenal, and I would just recommend it to you to escape for a couple hours. So with that being said, we'll now stand adjourned.